Hello everyone, my name is Jin and I'm a PAHI student at Conestoga College. Welcome to my information section video. In this video, I'm going to talk about the history, current state, education and certification options, and a discussion on the role of health information management professional in healthcare. Let's first take a look at what health information management is. HIM stands for Health Information Management. HIM focuses on the management of healthcare data or information regardless of the format, whether it's paper-based records or electronic. Key role of HIM includes managing the data, maintaining the integrity and confidentiality of personal health information, using the technologies to capture, manage, and analyze the data, whether it's for the care of patients, for the research, or for funding purposes. The history of HIM profession has traditionally focused on managing health records and hospital records, responsible for storing, reserving, and using healthcare data that was filed in paper medical records. Back in 1942, many medical records librarians came together to form the Canadian Associations of Medical Records Librarians. Their goal is to set the standards for records management and establish a college for standardizing the skills for practice. Today, this organization is called Canadian Health Information Management Associations, and we call it CHIMA. HIM profession has traditionally focused on the collections of quality data. HIM profession continue to evolve over time, becoming less paper-based and increasingly electronic. The focus now must shift to include the health system use of data, including business intelligence and decision support, based on a more complete understanding of the needs of the healthcare system in Canada. The current state is to focus on the information technology and electronic health records portion for ongoing changes. The demand for HIM professionals is also increased to meet the needs of healthcare. HIM professionals are no longer centralized in one single department, but rather are decentralized and able to apply their skills and expertise across the organizations, and as a result of these expanding roles, there's a growing demand for skills trained in HIM professionals throughout the healthcare industry. So, how do we get started in HIM professions? The first step is to get involved in the diplomas or bachelor degrees from an accredited institutions. A listing of HIM programs across the country can be found from the CHIMA Association Careers. Step 2 is to pass the CHIMA certification examinations and earn the health information management credentials. Step 3 is to participate in the CPE programs. CPE stands for Continued Professional Educations. CPE is important as it helps the HIM professionals adapt with the current trends of the industry practice, keep the professionals knowledgeable and up to date with the field, continue upgrade the skills and be able to keep in charge of the job, meet the future needs of the profession as well. In regard to the role of the HIM professional in healthcare, HIM is a joint responsibility of healthcare professionals, providing expertise to facilitate the process between the different professions and across the different organizations and care settings. HIM's role also to ensure the confidentiality of health information within the patient's records. HIM professional also work on providing guidance for on the health implementations, electronic health records, documentations, standards, and policy issues. HIM professional participate as a member of the team to provide quality of care by monitoring and evaluating the process, including government reporting, fundings, and research.